He's a small business owner. And he's also in Capitol Hill. Republican Representative John Fleming of Louisiana. Representative, thanks for coming on the show today, sir.
Cheryl, thanks for having me.
You have one heck of a perspective on health care. I want to start first with your background as a doctor. What would you do? Looking at what the plan is now from the president, what would you do to fix health care?
Well, I have been a practicing physician, a family physician for 32 years, and there's a lot I've seen in all parts of health care, financing and, of course, direct health care. And what I found is that patients want choice, they want control of their health care, they want it to be affordable, and they want a cure.
All right, so we've got all these uninsured Americans. We've talked to other doctors here that have said you've got to get insurance for everybody and get people out of the emergency room. Do you agree with that stance?
Well, absolutely. You know, we have 47 million uninsured Americans, Cheryl, and oftentimes what happens is because they can't afford to go to their family physician, they end up going to the emergency room late in the illness when outcomes are poor and the cost is much higher. So there's a tremendous amount of waste that occurs as a result of people not being able to have their own family physician have access to preventive care and early diagnostic care. And these are not really the poor people because they have Medicaid, nor the elderly, they have Medicare. It's the working poor, it's small business owners and their employees.
Congressman, do you think that companies should just get out of the healthcare business? Should it just be a system where, you know, we as individuals everywhere pay hopefully a smaller fee, a discounted fee, we get a tax break, and corporate America walks away from being, you know, the HMO of choice?
Well, I think there's a lot to be said about that. One of the major problems, there's really two major problems that patients are up against these days. One is lack of portability, meaning that if you move to another employer, if you're unemployed, you could lose your insurance, and the other is pre-existing illnesses. So I think it's fine for employers to provide that if they choose, but I think we need to reform insurance laws where individuals, whether they're working or not, or no matter who they're working for, can carry their insurance with them and not be subject to pre-existing illnesses.
All right. Well, we've got the doctor part of your resume covered, and then the small business owner. Let me ask you this. The president today met with many business leaders, Microsoft, Pitney Bowes, Johnson & Johnson CEO was there. He made a few comments after. Do you think that the president is going in the right direction by meeting with these business leaders who, in some cases, have had success in managing health care costs at their own companies?
Well, I think businesses, of course, they get consultants and they can do a very good job in managing health care. The problem is, Cheryl, that what we have today, which is Medicare and Medicaid, which is government run, a significant part of our health care, has inherent fraud and abuse, which cannot be controlled because government cannot micromanage people. And if you expand that to a single-payer system like our president would like to do, and many Democrats, what you're going to end up with is a system that's unsustainable because currently Medicare and Medicaid is to a great degree propped up by taxpayers and private insurance. So if you expand it to where we have a total government-run single-payer system market, you're not going to be able to control costs. You're going to end up with rationing, and you're going to knock the you're not going to see proper competition between private and public health plans.
Real quick, I got to ask you, because you are from Louisiana, many of the southern states have a big problem with illegal immigrants coming over the borders, having children, using U.S. healthcare systems. They pay nothing. Real quick, do you have a position on that, sir?
Well, yes, I'm very concerned about that. I see no problem if immigrants are legal. They pay into the system like anyone else. And of course, they receive health care as a result of their paying into the system. But on the other hand, you know, the S-chip bill that passed a little earlier this year actually took down the verification process. And so many illegal immigrants now can get health care, really a Medicaid card, with very little verification of that.
All right. So real quick, again, because I know you're a practicing physician, if there was one piece, is it the examination room? Is that where you think the problem is? Is it drug
Absolutely.
companies because of what it costs them? You say it's definitely the doctor-patient relationship.
Yes.
First place we got to go. Okay.
Well, Cheryl, it's the exam room because the doctor and the patient make 99% of the decisions, and there's such a difference between what a doctor and a patient can do that can save money and get good results versus the other way. And under a government system, you can't micromanage that. Under a private system, you can have administrative evaluations and education for physicians and patients, and you can incentivize them to work towards good health, preventive health, and early diagnostic care. And I think you save dollars and get much better outcomes.
Congressman John Fleming from Louisiana, you have one heck of a unique perspective on health care, sir. Thank you for being on Fox Business today.
Thank you very much. Good to be here.
Well, you know, speaking of President Obama, a short time ago, the Vice President